love doing panels like this. We call them the Oprah-style panels because it's more of a question and answer, and I get to play Oprah Winfrey. And what's really cool about that is Oprah Winfrey is just such a cool character in person. She's really rich, and she gives things away. So I feel like Oprah right now, so I'm going to give you get a free Lancet. You get and Raphael, you get a free Lancet. Everyone in this audience gets a free Lancet. And you get a crazy sound. So thanks for indulging me. That was fun. My name is Suzanne Petroni. I'm with the International Center for Research on Women here in Washington, D.C., and I'm also proud to say that I have served on the Lancet Commission on adolescent health and well-being for the past 3.5 years. It has been 3.5, so coming up on 4 wonderful years. And I'm also proud and just have learned so much from my colleagues on the commission, Sabina Kleinert, the editor of The Lancet, George, Susan, Kike Lomo, John Santelli, Terry McGovern, others who are here today. It's really been a tremendous experience. So thanks to those of you, and you've heard them speak today, so you, I think, can get a sense of just how amazing and passionate and wonderful they are. And I do hope that you not only take the physical copy of The Lancet, for those of you who still read words on paper, take it with you, read it on the plane, on the metro, because you're going to be on the metro for a while if you live in DC. And for those of you watching online, the report is, of course, online, and I think pretty digestible. We really tried over the course of writing this commission report to make it accessible, particularly to donors, policymakers, and program designers and implementers out there. And so this is something that several of us on the commission have been looking to do throughout the development of the commission, is to make it usable, make sure that we have concrete recommendations, really be able to articulate what some key messages are, but also to then turn to the donors and the policymakers out there who will use this evidence and find out from them, how can you do this? How can you use the information that we've put forward in your programs, your policies, and in your program design for those of you in the audience and watching online to use. So that's what this panel is about today. We're going to take a little bit less than an hour here in our Oprah-style conversation, and then we're going to make sure that we have ample time for Q&A, because as we heard in this last session, there's a lot of knowledge and great perspectives out there, and we want to capture those. Also want to mention, for those of you tweeting, we are trending on Twitter. Lancet Youth hashtag, please keep tweeting. And if you have questions and you don't want to raise your hand, or if you're watching online and want to submit a question, use that hashtag Lancet Youth, and someone, hopefully Erin's going to capture those questions and we'll try to fit those in. So let me go ahead and introduce our panelists. I'm not going to give you their bios, you have those in the packet. I will just give you names and associations, and then we'll start our conversation. So first up, we have Dr. Jennifer Adams, the Deputy Assistant Administrator for Global Health of the U.S. Agency for International Development, USAID, here in Washington. Thank you for joining us. Dr. Soji Ade, you already heard him speak this morning, the Director of Health, Population, and Nutrition Global Practice at the World Bank here in Washington. Thank you again. Dr. Miriam Clayson from the Bill and Melinda Gates Foundation. She leads the maternal, newborn, child health work there, and came in from Seattle for this panel. So thank you not only for flying across the country, but as has already been acknowledged, for the tremendous support of the foundation for the commission. Thanks. Dr. Laura Lasky, who I've worked with for a few years now, the Chief of Sexual and Reproductive Health at the United Nations Population Fund, UNFPA, who came down from New York to join us. And then joined again by Kike Lomo Taiwo, who you heard this morning is an incredible, powerful advocate who also has served on the commission with us and who also came down from New York to join us. So we're going to start our Oprah-like conversation. And I want to start with talking a little bit about the reframing of adolescent health and well-being that we've seen in the commission and we're trying to put forward. in terms of helping to break out of the siloed approaches that we in the global health and global development field have put adolescents, if we put them on the agenda at all, we had put them into these programmatic silos, as George has shown, mainly so far in HIV and sexual and reproductive health. What we tried to do on the commission, and what I hope you heard a little bit of this morning, is to position young people as holistic human beings who don't live their lives in silos and whose needs and assets need to be addressed in multi-sectoral ways, right? We need to break out of those silos that we've long been funding. And so I'm interested in hearing how each of your agencies and institutions is doing that, looking at young people in positive and multi-sectoral ways, and if it's not currently happening, how you envision doing that in the future. So let me start with you, Jennifer, and I do want to note that the Commission's findings align very much with USAID's Youth and Development Policy, which came out in 2012, which really started to reposition the focus of the agency on young people and adolescents, looking at them more holistically, looking at them in a multi-sectoral way. So can you tell us, this is a great policy, how is it being operationalized in practice?
Okay, sure. If I had thought, I would have brought a lot of copies of the policy, and then you could have had another Oprah giveaway of USAID's Youth and Development Policy. So I think the development of the Youth and Development Policy was important in a couple of ways. It was important in terms of the content of the policy, which, as you say, definitely stresses multi-sectoral approaches and looking at youth in a holistic way. But it also really addresses the other theme that came up earlier today of seeing youth in a positive light as instead of a problem, and focusing on the assets and the potential that youth bring to a variety of development issues rather than a problem to be solved. It was significant for that, and I think it was significant also because it brought together people who were interested in adolescents and interested in youth from across USAID. So not just in the Global Health Bureau, but in other sectors as well. And operationalizing that kind of multi-sectoral approach is happening now through a pretty, I think, significant institutional commitment that USAID has made, which is the Youth Power Program. So it's close to $500 million that USAID is investing in two complementary programs. One of them is Youth Power Implementation, and the other is Youth Power Evidence and Evaluation. And that is partly in recognition of the fact that while we certainly need these holistic interventions and we need positive youth development cross-sectorally, we also need at the same time to be paying attention to what we learn from that and seeing in specific countries and specific contexts what works, what doesn't work, and helping to continue to build towards a bigger body of evidence. Data, as was said this morning, is really lacking for certain age groups, certain demographic groups, and sort of in general, to answer the kinds of questions that people who are involved in youth development really want to know, which goes also beyond just the statistical side. So in that, we have begun the work on implementation in 6 countries now. The program has been, I would say, operational for close to a year. And so we have actual interventions and cross-sectoral programs that are active in 6 countries and more coming online. And through the evidence and evaluation component, we've established communities of practice that are available to anybody. It's using new technologies, information technology. And they include youth engagement, soft skills, gender and youth development, and youth in conflict. So we are just beginning, and we're really hoping that through this iterative approach of having both interventions and implementation, and at the same time linking that to evidence and evaluation, that we'll be able to, in the future, have more examples and more evidence and experiences to share.
Thank you. Thank you. Yeah, the Youth Power commitment is truly extraordinary. It's, as Jennifer said, almost $500 million that the agency is committed. Full disclosure, ICRW is on a team that is helping on the evidence and evaluation side with Making Sense International to help build that evidence base around positive youth development. And so we know from the inside it's really an extraordinary project. That said, it is a distinct program. And so I wonder if you can talk about how, aside from the youth power investment in specific programming, how within the agency, various bureaus, including your Bureau, Global Health, is making sure to really incorporate that positive youth development aspect of the youth and development policy, as well as the multi-sectoral approaches.
Right. Yes, so this is kind of a companion to the Youth Power Program, which is a direct investment that's clearly targeting young people and adolescents. And not all USAID offices or USAID bureaus have that kind of dedicated funding, and they have strategic objectives that are quite specific. So one of the things that the policy in USAID got at was how to take these quite sector-specific objectives and the funding that is allocated toward them, and to incorporate into that an attention and an awareness about young people and about adolescents. And so I think we do see increasingly across the agency understanding the importance of age segmentation and looking at different age groups, and in particular targeting young people. That's obviously helped by the fact that many USAID-assisted countries, between 35 to 40% of the total population are below 30. So the demographic situation in many of those countries also spurs that kind of attention that you begin to see across USAID. And I think we want to encourage that, and within USAID, the group of dedicated staff on youth power, which cuts across a number of the different bureaus and a number of the different offices, try increasingly to make everyone aware of issues that came up today, the social norms, the physical and mental development, and the fact that behaviors that you initiate in adolescence can last for a lifetime, either in a very positive way or in a not so positive way. So it needs to be a part of programming across the board. So just a couple of examples I think that would be interesting to share about positive youth development and the multi-sectoral programming. One is, I think, in the Office of Population and Reproductive Health. They are expanding a lot of the work that they are doing kind of upstream with very young adolescents, trying to reach very young adolescents with important information and skills before they become sexually active. So that includes fertility awareness, body awareness, healthy sexuality, gender norms, and other protective factors that you need to work on, including very positive relationships with parents, and I think also something that didn't come up today, with other adults. Also, we have, I think, some progress in looking beyond the sector, or in the case of global health, even subsector silos that are very common and very prevalent. Trying to bring strands together to meet the needs of adolescents more generally. A couple of examples, I think, are the DREAMS initiative, which some of you might be familiar with, which really has as an overarching goal to reduce HIV infection in adolescent girls and young women. One of the examples that we have are young women in Zimbabwe for whom the DREAMS initiative is assisting with income generation, in part because one of the reasons that young girls don't stay in school is lack of ability to afford the school fees. So trying to involve both young women and their parents and other adults in a way to make sure that there's an income stream that can guarantee that they go to school. That's kind of gone a step further, I would say, in the specific case of Malawi, where an announcement was made just a couple of weeks ago about a $40 million initiative in Malawi specifically to keep girls in school, adolescent girls in school, and trying, if possible, to keep all of them in school, and seeing what that takes in a relatively small country like Malawi, but with a very robust demographic bulge in the adolescent age group, and to see sort of what that takes, both in terms of the resources that are required and in terms of the participation by the adolescent girls themselves and by their families and their communities. So those are just a couple of examples of how we're trying to build those kinds of links and bring in sectors to address adolescents in their programming.
Thank you. Thank you.